Hello everyone, I'm Janet Giretuerto and I'm going to report to you right now about Zika. So what is Zika? Zika is a disease which is caused by a mosquito-borne flavivirus and first identified in Uganda in 1947 in rhesus monkeys in the Zika forest. That's why it was called Zika virus infection because of the forest name itself. It is later identified in humans in 1952 in the country of Uganda and the United Republic of Tanzania. The outbreaks until now, it's happening in the Africa, the Americas, Asia, and Pacific. So here are the important dates that give the updates of the epidemiology of Zika. From 1960s to 1980s, there were rare sporadic cases of human infections found across Africa and Asia, and that time it was only typically accompanied by mild illness. By March 2015, in Brazil, there was a reported large outbreak of rash illness and soon identified as Zika virus infection. So at first it was only mild illness, then the second one is rash illness. Then when July 2015 came, there was in an outbreak of Guillain-Barré syndrome, which is found out to be associated with Zika virus also. As of October 2015, the Brazil reported an association between Zika virus infection and this time microcephaly. So later on we will discuss what what brought this microcephaly to be developed, especially to the fetus and to the babies. And up to date, a total of 86 countries and territories have reported evidence of mosquito transmitted Zika infection. So in this slide, we will see the countries and territories which have active Zika virus transmission according to CDC. So as we can see, the violet portions that cover the countries. These are the countries that have in Zika virus infections, and this is the Philippines. And it's not in the violet color, but still it has cases of Zika virus infection. Of course, it's very important to also know the epidemiology here in our country of Philippines. So, February 2017, said by DOH, there were 57 cases of Zika virus. 38 of those are females and 19 are males. And the ages affected range from 7 years to 59 years old. In the region of National Capital Region, there are 20 cases, Calabar Zone 18 cases, Western Visayas 15 cases, Central Zone 2 cases, and Central Visayas 2 cases. And 7 out of 57 are pregnant women, age 16 to 32. Then, September 2018, there was a current news which was a 3-year-old child from Mangaldan, Pangasinan, was infected with Zika virus, according to the Provincial Health Office of Pangasinan. But because of the treatment and prevention, the child was treated. But what's alarming to the PHO, what if the mosquito infected by a Zika virus um, bite a pregnant woman? So it may result to not that really good, because if it's a real severe bite infection, the fetus or the baby will have defect when it's already in his or her birth. And then for the pathophysiology, it is transmitted by an Aedes mosquito, particularly the Aedes aegypti. And we all know that Aedes aegypti is the same mosquito that transmits dengue, chikungunya, and yellow fever. And yes, they bite during the day. The peak time is during early morning and late afternoon or evening. This is just a simple representation of the pathophysiology of the viral attachment to the endocytic uptake. Once it's inside of the nucleus, it will going to uncoat the nucleocapsid, and there will be a release of viral RNA into the cytoplasm. So this is how the Zika spreads in the family and the community. This is a continuous cycle, but let's just assume that it will start here. If there are travelers or that have a vacation with other countries that was infected by Zika virus, and then if the person is already infected because of a mosquito bites, and then she will going to feel he or she will going to feel mild illness or rash illness or um, joints pains, and the mosquito that will going to bite that person will become infected too, and then the mosquito will often live in a single house during its lifetime. And if the family member or neighbor is not are not that really in good hygiene or have a poor sanitation, they might also infected by the mosquito bites. And then more mosquitoes get infected and spread the virus. Then more members in the community become infected. So the cycle will just continue. And then the other less common ways that people could get Zika, and it's really alarming if this will get by a pregnant woman, and there will be a birth defect. Later on, we would know what are those defects. And then through sex, Zika virus can also be transmitted, and then blood transfusion. The incubation period means the time from exposure to symptoms of Zika virus is estimated to be 3 to 14 days. And then the majority of people that were infected by Zika virus are asymptomatic. They don't feel any symptoms until or even know they are infected with the virus. But the symptoms are only generally mild, including the fever, rash, conjunctivitis or red eye, muscle and joint pain, malaise, and headache, and last for 2 to 7 days. So, as the ratio says, 4 out of people won't have symptoms or even know they are infected with the virus. And the most common symptoms of Zika are here. What about the pregnant woman? When an Aedes mosquito bite a pregnant woman, um, her child might have a birth defect like microcephaly. Like it was called congenital Zika microcephaly. And so we can see here, this is the normal size, but because of microcephaly, there is an decrease in size of the head. Here is the Guillain-Barré syndrome. It is the damaged myelin. It is the healthy myelin. So there will be a decrease in muscle growth. And here is a baby suffering from Zika virus. Decreased size in the head. So what are the risk factors for infection? Like what I said lately, travel to areas with active Zika virus transmission, sexual relationships, recipient of Zika virus contaminated blood, and maternal Zika virus infection from the pregnant woman to her child. And for complications, here are those. What about the diagnosis? What are the diagnostic tests used to confirm there is a Zika virus infection? So the medical field can use RNA NAT testing since the Zika virus is targeting the RNA. Could be IgM testing also. And also culture for virus, but not that generally used clinically. For the DOC in treatment, sadly, there's no treatment available. There is no vaccine available, but still, it remains an active area of research, the development of Zika vaccine. But the symptoms that includes fever, rash, or arthralgia, it could be prevented or treated with non-pharmacological ways like plenty of rest, drink fluids, and treat pain and fever with common medicines like antibiotic medicines or analgesics. For the DOC treatment or prevention, of course, like with the other mosquito-borne diseases, to wear long sleeve shirts and hats, and if possible, not that in dark color because that's the color that the mosquito wants. To use effective insect repellents, to sleep under mosquito nets on beds, to empty or clean containers that holds water, to protect windows and doors with mosquito nets or those screens, to use insect repellent for clothing. So what are the programs? Internationally, World Health Organization is very active. They support the countries to control Zika virus disease by taking actions outlined in the Zika Strategic Response Framework. So they really did a framework against Zika virus. These are the some of the guidelines stated there in the framework. Also, the progress toward discovery of Zika virus vaccines, like last July 2018, the public health emergency of international concern in February 2016 is to develop Zika virus vaccines and treatments. Because of that, there were 45 candidate vaccines entered the research, developed pipeline, and several progress to human clinical trials. Also, the R&D blueprint, they made a list, the 2018 annual review of the blueprint list of priority diseases, and the diseases that were included there means there is an urgent need for accelerated research and development. And of course, we're happy that Zika is also belong there. Also, the GVCR or Global Vector Control Response 2017 to 2030 Vector Control Operations Framework for Zika virus. For the national, here in the Philippines, DOH is also active. Actually, they did Department Memorandum Number 2016-0116 contains technical guidelines, standards, and other instructions for reference in the implementation of Zika virus disease surveillance. And also the DOH is still suggesting the 4S strategy. And as of October 28, 2016, at MOA Complex Pasay, the Research Institute for Tropical Medicine, the RITM, and collaborated with the Disease Prevention and Control Bureau, Epidemiology Bureau, Health Promotion and Communication Services to conduct a national summit on Zika virus disease with the theme One Philippines Against Zika. And once they post about that summit, they post also the hashtag 1PH Against Zika. And we all know that still the World Health Organization and the Department of Health is looking for additional programs for the advancements of medical field when it comes to fighting against Zika virus infection for the benefit of the community and the public. So here are my references and you can visit. Thank you for listening and for viewing to my report. I hope you learn a lot.